Measles in Maryland. Tonight, state health officials confirm a case of the disease. They say a person contracted it outside the country. WJZ's live George Solis reports others may have been exposed to the illness. George.
Vic, state health officials not identifying the patient, but they did release all the locations the person visited while carrying the highly contagious disease. Health officials in Maryland now alerting the public of potential measles exposure in and around the state. So far, a single case of the disease has been confirmed in a person who contracted it outside the U.S.
This was an adult, and so when the person realized that they really were sick, went for care, that's when we were able to get some blood work and do some testing and realize that it was measles.
The unnamed individual flew into Dulles International on May 15th, visited a Nordstrom Rec in Gaithersburg on May 17th, and on the 18th stopped by the Circuit Court of Maryland in Rockville. Some county employees telling WJZ that they were notified about the possible exposure. This mother says she didn't know, but she and her newborn have already been vaccinated against the highly contagious disease.
Oh yeah, for sure.
Measles can spread through coughing and sneezing. According to the CDC, the disease can also live in airspace for up to 2 hours. Typical symptoms are not unlike the flu: fever, cough, runny nose, and watery eyes. But there is one signature telltale sign.
You get a rash. You get a red rash.
Health officials warn it can be several days after exposure before you develop symptoms. However, those who have been vaccinated are unlikely to get ill. The recently diagnosed patient is now under treatment. And health officials say once you have the measles, there isn't much you can do other than to ride it out. They do say if you notice symptoms, to avoid exposure to people. Live tonight, George Solis reporting for WJZ.
George, thank you. According to the World Health Organization, measles is one of the leading causes of death in children.